This has got to stop. What we're talking about today is physicians. I don't even really care what doctors they are, but some of this stuff has got to stop. Hey, what a transition. Hey, I'm Jason, otherwise known as Jolson. I'm a registered polysomnographic technologist, but you don't care about that. So I do a lot of PAP therapy analysis with people on my website, axgsleepdiagnostics.com. And what I am always hearing, people don't look out, people don't go to a YouTuber for help unless things are dire. Let's get that straight. And when they talk to me, the first thing they say very often is their doctor gaslit them, their doctor didn't listen to them, things of that nature. So number one, doctors, you know what? Actually, this is gonna come across as a rant. So let's go ahead and rant first about our video sponsor. Now, we're gonna stay in character, we're gonna stay angry. So hey, what's the deal with this CPAPsupplies.com? CPAPsupplies.com, they're great and all, but we've got some issues with them. One, every time they use my discount code, by the way, check them out, great company. Every time they create a new discount code for me, they drop it. So I'll go to their website and it's like, oh, discount code, look at me, 30% off. What? Oh, but Jason, you can go ahead and have Lanky 20, they can get 20% off. Oh, so they're not gonna use it? Yeah, that's right, you just go away, do your little videos. So then at the end of 2023, right, they're like, goodbye 23. So that's supposed to be like, goodbye year 2023, and you can save 23% off. I'm like, oh cool, that's higher than 20% off. So I go to the website and it's like, 25 alive or something. What? Anyway, for the month of December, you can use discount code goodbye23. Tons of great masks, great accessories. You can get 25, God, I'm starting to forget now. No, 23, my bad. You can get 23% off through the end of December, the end of this year. Goodbye 23. You can use your HSA and FSA account. We all know you got some extra cash in there. You can use that to buy any mask you want, and you can use it to buy any accessory you want, saving 23% off. Fantastic deal. Thank you so much to the sponsor, CPAPsupplies.com. All right, so let's talk about this. I've actually seen this in real life. It's insane. It often looks like this. Hi, this is always during a follow-up appointment. Hi, I'm feeling terrible on my CPAP. Are you? Yes, I am. Well, I'm looking at your data here. And by the way, when they say I'm looking at your data, they're looking at the numbers your machine spits out. I've done this on other videos, but we gotta do it again. Well, it says here your apnea-hypopnea index is 1 point whatever, it's 2.3, it's blah point blah. Yeah, I understand that, but I'm still really tired. Yeah, but it says your leak is great, it's acceptable. It's 18 liters per minute, wonderful. Yeah, but I'm still really tired. Well, all your blood work looks good, so I guess I'll see you in 3 months. That's a very typical interaction. If you think I'm kidding, I'm not. I'm being 100% for real on that. So how frustrating is that for the person? Now, this, I would say, this is 100% gaslighting. They're just telling you, no, you feel good. Nah, you look good. Your numbers are good. You look good. You feel good. You're good. Bye-bye. Make sure you hit the gift shop on the way out, toots. That's pretty much what the interaction is like. Then you have people that go in and they want to show them Oscar data because they're like, aha, I know you don't look at the data, so I'm gonna bring the data to you and force you to look at it. Now, some doctors are cool and they're like, wow, I did not know this existed. I can't make a decision on it now because I'm not familiar with it, but I love it. I'll take a look. Those doctors are cool. Then there's the ones that are willfully ignorant. And what I mean by that is they see the data, they say, that could be a good tool, but they throw up tons of roadblocks as to why they're not gonna use it because it doesn't fit into practice. I call that willfully ignorant because they're really not even looking to explore it. And I mean, let's face it, it's data from the machine. The machine that they prescribed, it's the data from that being reported by a different open source software program. How you don't like that, I don't know. But to be frank with you, when I'm doing these PAP analysis, it doesn't take long to look at that data. You can look at it very quickly and see very easy patterns emerging. So there's no need to be willfully ignorant about it. It's what your specialty is. Now, I just want to be very clear. I am very ignorant on a lot of things. Willfully, no. There's some stuff I don't have time to look at, but willfully ignorant is worse than just being ignorant. I'm ignorant on plenty of stuff, as are you. It just happens. You can't know everything. And now there's another problem, and this is probably a bigger problem, because another thing I very often advise people is go into your doctor, your visit with a plan. We know they don't have a lot of time, okay? That's set. There's nothing we can do about that. But what we can do is have a script prepared in our head of what our problems are, what we've tried, what's worked, what hasn't, and what we'd like to get out of the appointment. I think that's really important to stay on task because the doctors otherwise are just gonna kind of flick you through there. So you guys want to hear a funny story? Now it has to do with Grandpa Lanky's wiener problems. Would you like to hear about some wiener problems? It's funny, you know what? I had a person the other day that said, you sure like to make a lot of wiener jokes on your channel. I'm like, I'm kind of like a 12-year-old boy, okay? I don't know what to say. So, serious problem I've been having, and I'm gonna go ahead and share this with you because it's a very common male problem, and apparently 90% of my viewers are male, so maybe you guys can help me out with this. So I've been having this problem, and I wanted to just get it checked out because it's enough of an issue that it's just like, you know what, this is annoying. I don't like this. So I go in with my plan. This guy's supposed to be the best in the area, supposed to be the best. Sits down and he says, okay, so what's the problem? And I say like 2 words. I say, so sometimes I urinate and it's very normal, and sometimes, and he cuts me off like right there. Is it painful? No. What does it look like? Well, it's like clear, it looks like urine. How does it shoot out? Well, sometimes it's a spray pattern, sometimes it's normal. You drink plenty of fluids? I mean, I drink when I'm thirsty. And he goes, aha! I'm like, what? And then he starts launching into this tirade about how the whatever industry forces us to drink more water and we are overhydrating, and that overhydrating is making us pee more and all this stuff. And I'm like, this is like seriously like 3 minutes, and I keep trying to like interject. I'm like, yeah, I just drink when I'm thirsty. And he's throwing weird shit out there that I've never said. So I finally had to like, dude, stop. Like, what do you stop? I haven't said any of that. I said I drink when I'm thirsty. I don't feel like I overdrink. And certainly when I'm having an urgency to pee and then there's nothing there, I'm not out there chugging bottles of water going, derpa there. Is there a correlation here? So I said, no, you're putting words in my mouth. And he like kind of, whoa, hey, whoa, I need to call security in here? I was like, that's not what I said at all. I said, it's intermittent. Sometimes I have to pee like a lot and I haven't drank anything. And then he starts going into something about, well, sometimes you'll take a drink and you're like, I drink because my mouth is dry, and you'll drink and you notice your mouth is still dry. And I never said my mouth is dry. I said, what are you talking about? I said, could you do me a favor and just please be quiet and let me say what's going on? So this is one of the problems I have with physicians is do me a favor, say, you got 3 or 4 minutes, the floor is yours. Tell me what's wrong. Everything you think is important, please tell me right now. However much time it is, just shut up. Just shut up and let people get it out. And then you don't have to ask those questions that interrupt them telling you what they've been going through. And you'll probably get more out of it and not sit there spinning your wheels on other crap you're thinking about that has nothing to do with the patient. So shut the front door. You know what this guy was like? This is a good analogy because I was thinking like while I was in there, I'm like, everyone's got a plan, like Mike Tyson. Everyone's got a plan until you get punched in the face. And then I go in there with my plan and he starts whack, whack, whack. And I'm like, he's like kicking my ass with these, like just interrupting me. If he was a dinosaur, he'd be an interruptosaurus. Boom, gotcha. So if you grew up in the 80s like myself, you remember Mike Tyson's Punch Out. You'd have to do like a pattern for all the boxers getting up to Mike Tyson. And then this guy was Mike Tyson and he had the pattern. He'd like, his eyes would blink and you're like, ha. Here it comes, the big combo, the whap, whap. He starts smoking you. And if you get the combo right, you time it right, you can beat Mike Tyson. So he starts doing his thing. I can see his eyes blinking. He's about to hit me. And I'm like, oh yeah, baby, I got this one. I know the pattern. I tell people the pattern works. I've done it before. It's time tested. So then he starts launching into it and I panicked because I did that thing where I started thinking back, oh God, if I don't get this right, I'm gonna go back. I have to go back to this boxer and he's pretty tough. King Hippo's kind of tough and he's not really fun to box because you just have to hit him in his fat belly. Then you got this other guy and this other guy. And then you're like, oh God, if I mess up, I'm gonna whap. And Little Mac goes down. And that's what happened to me. I got jacked, Little Mac went down. But you know what I did? I put another quarter in. And I got back on that horse. So I said, doctor, just do me a favor. Please let me just speak for 1 minute uninterrupted. Don't say a word. And he goes, puts down his pen and clipboard. And I'm like, well, I didn't say this, but you don't have to be a cocksucker about it. Go ahead and still take notes because this is where you're actually gonna get information. Sometimes I pee normally, sometimes I don't. Sometimes I'm standing there for a minute and I get drip, drip, drip and feel like I still have to pee but can't get anything out. Other times I can hit a fly from across the room with such force. By the way, if you like wiener stories, like and subscribe. If you don't like wiener stories, you're probably already off here, but still like and subscribe. I read on the internet.com that sometimes coffee and stuff like that will make it bad, so I actually abstained from coffee for a good 2 weeks. Didn't notice a difference. Don't notice a difference in things I eat. Don't notice a difference in things I drink and how much I drink. Nothing seems to change it other than it's hella random. And right now I'm at the best I can possibly be because another doctor has me on Flow Max. It's supposed to help you flow to the max. Boom. Hello marketing. And the other is just hella low dose Cialis to keep my prostate happy because I've been diagnosed with benign prostatic hypertrophy or something like that. Enlarged prostate. How do they know that? Well, because they stuck a finger in my butt and flicked it a few times. So that's what I got, doc. Go ahead and hit me with some sage advice. And you know what the dickhead said? Well, if everything's great, then why are you in here seeing me? Hey, dick neck. Not what I said. So then I had to calmly say, like I said, just now, this is the best it's been and it's still not acceptable to me. Is there anything you can do for me? And he basically said, there sure is. I need you to stay off coffee for 1 month. I'm gonna have you come back and pee into a machine, and I'm gonna stick a weenie probe in you. Well, that sounds freaking terrifying, but okay. I'm at a loss, guys. What do we do about this? I personally feel like I'm not an aggressive person, but I can certainly articulate my problems and my dissatisfaction with certain situations if needed. And not in a rude way, just like a, stay with me, bubs. Forward this video on to every doctor. This stuff has got to become a thing. It's got to be taught. It's got to change. It's crazy. They need to implement a 2-minute or something hush-hush time where the patient can just talk about what's going on with them. And if they choose, like in Congress, to yield back early, that's on them. But just shut up and listen, please. The 2 takeaways: stop with the gaslighting and shut up and listen. And then us as patients, we'll go in with a plan, and the plan will be concise. All right, guys, if you have any advice on this, on anything, what your thoughts are, I'm super curious. Please leave them in the comment section. Do me a favor, check out the description box for helpful links that help this channel. And other than that, I'm out. Grandpa Lanky, rant off. Done. Very therapeutic. Thanks for watching. Bye.
Clean your stinky mask with some Mask Bright, available at Amazon. Thank you to all watching, but an extra thick thanks, buddy, to Doug Toombs, Jason Georgiades, Patricia Espelong, Starvesh Joshi, Stuart Hetherington, Mona Swearingen, Chengtu Chen, Edward Steiner, Deborah Permute, and Shannon Kerr, and another slightly less thick thanks, buddy, to all the other YouTube members, Patreon supporters,